The renal system, part 3, application of concepts of altered elimination. The other word for kidney stones is urolithiasis, or renal calculi. 3 words, same thing. And these calculi precipitate out from the filtrate. Go back to when we talked about stasis and mobility. This is how the kidney stones are formed. What are they formed from? Well, there's 3 different types, and these are all different things that could precipitate out from the filtrate. One of them is calcium oxalate and phosphate, and people who are prone to get this type of kidney stone are people who have hypercalcemia or hypercalciuria. That means too much calcium in their blood or in their urine. People who are immobile and people with renal tubular acidosis. Those are the 3 types that are especially prone to getting the calcium oxalate type of kidney stones. People with urinary tract infections are more likely to get the ones that are formed from magnesium ammonium phosphate, or struvite. And the third ones are formed of uric acid or urate, and they precipitate out in acidic urine that's 5.5 or less. They're found more in people who have a diet high in purines. Purines are found in all foods, but they are especially high in proteins. And these uric acid stones are also found in people who have gout. So, what causes kidney stones? Urine stasis, immobility, bladder infections, renal tubular acidosis, and elevated levels of the different salts, calcium, purines, organic or inorganic salts. And all of these cause an increased risk for renal tubule obstruction. The classic clinical manifestation for kidney stones is pain. It may be a pain called colic, which is caused by the distension of the collecting system or the ureter. The stone is pushing on the tube and forcing it open, causing acute, intermittent, radiating, excruciating pain. Or it is a non-colic pain, which is caused by the stones causing other areas in the kidney to distend because there's lots of fluid. There's too much fluid backing up in it, and that's usually dull and deep, and again it varies with intensity. So what do we do for kidney stones? Take care of the pain. That's one of the major things we have to do, is take care of the pain, because this is an excruciating pain. And the second thing is, let's get rid of the calculi, the stones themselves. Well, we can do that by trying to increase fluid intake. Remember, one of the causes of kidney stones is stuff precipitating out from the filtrate. So if we can keep the filtrate as unconcentrated as possible, we're less likely to cause them. And the increased fluid intake also makes it possible to try and wash some of the smaller ones out of the body. We work on trying to reduce the size of the stones, and that's extracorporeal shock wave lithotripsy. And I did put a assignment for you to watch a different video on that. It's very short. And the other way we can get rid of them is by surgically removing them. We can use the percutaneous nephrolithotomy, which is a laparoscopic approach, cutting through the abdomen to get to them. Or we can do the ureteroscopic stone removal, which means we're putting the tube up through the urethra and up into the ureters themselves to try and get rid of the stones. Trying to prevent them, again, fluid intake. Changing diet, either by choosing foods that are lower in calcium oxalate. There is a list in your text, please know them. By lowering protein intake, of the diet and by limiting sodium intake.